Hello, everyone, and thank you for joining today's virtual workshop with the Cancer Support Community Los Angeles. I'm Kathy Riley, the Associate Director of Programs at CSCLA. I'm honored to welcome you to this week's webinar titled Sex, Intimacy, and Cancer Thrivers. Let's talk about the elephant in the room. Before we begin, if this is your first time joining us, Cancer Support Community Los Angeles is a premier nonprofit organization providing vital social and emotional support to families facing cancer, including patients, caregivers, and their loved ones, all at no cost. Our programs include support groups, healthy lifestyle classes, social activities, and educational programs such as this one. If you would like to learn more about our services or watch past programs, you can visit our website at cancersupportla.org. And before I introduce today's speaker, note that your video and microphone are automatically disabled for this webinar. You may, however, enter questions into the Q&A feature found at the bottom of the Zoom window at any time. We won't be able to get to every question today, but we'll be posting an email at the end of our webinar today that you can send your questions to if we don't get to yours. Dr. Sheryl A. Ross, also known as Dr. Sherry, is an OBGYN, author, and health expert. She has been a fierce advocate for women's health for over 25 years. Her first book, She-ology, The Definitive Guide to Women's Intimate Health, period, was named one of the 6 most life-changing wellness books of 2017 by Prevention.com and Women's Health magazine. Her second book, She-ology, the she-quel, Let's Continue the Conversation, was released in 2020 and continues to be a bestseller. And at the core of what Dr. Sherry is most passionate about is educating women and men and giving them the permission and the tools to live a healthier life. Dr. Sherry, it just gives me great pleasure to welcome you to this webinar, and I will let you take it from here. Feel free to share your slides and begin your presentation.
Thank you, Kathy. I so appreciate you allowing me to join and talk about this topic, sex, intimacy, and cancer thrivers. Very near and dear to my heart. Let's see if I can, here we go. Let's talk about the elephant in the room. I mean, clearly, this is just a under-discussed topic, as you all know. Whether you're a cancer thriver, whether you're, in the trenches, treating, counseling, what have you, it's an under-discussed topic. For those of you who don't know me, some call me the vagina whisperer, the JJ expert, vaggie seeker, vag doc to the stars. My 3 sons, they just call me embarrassing. And I've been doing this for over 30 years. And what I realize is when a woman's legs go up in stirrups, that is when the conversation really begins. And in my first book, I wrote a chapter called The Pink V. And it really had to do with this topic of, who's discussing these issues. So I appreciate this opportunity to really talk about it because I realize the need and the necessity, and I'm all about bringing things out of the closet. So let's just dive in a little bit and get started, and just to sort of go over some of the facts, right? I mean, we know 1 of 3 will be diagnosed with cancer in their lifetime. There's 31.1 million survivors of breast cancer, 64 million women in menopause. 60% will experience, this disease in a different way, but we know it affects the sex organs. So it's very, very prevalent to sexual well-being. Now, a study that was done by the Lance Armstrong Foundation found that 43% had problems with sexual function following their treatment. No big surprise to a lot of you. And up to 30% had a lot of problems. But here's the sad statistic that just gets me every time, that only 13% discuss their sexual problems with their healthcare provider. Now, what are the most common problems that women experience? So I did underline, for those of you who submitted questions, a couple discuss loss of desire, bleeding after intercourse. So if you see something underlined, this is where this comes from. These again shouldn't surprise you. Loss of desire, failure to become sexually aroused, vaginal dryness from premature menopause, pain with sexual activity and intercourse, bleeding after any sexual activity, of course, due to dryness, problems with orgasm, emotional changes, for what gazillion reasons, whether it's because you're gaining weight or you're not happy with, any surgery that was done as a result of your cancer, just not feeling good. And of course, all the physical changes. And of course, these are menopause, weight gain, hair loss, from cancer treatment, swelling from lymphedema, skin sensitivities, affecting the body's response to touch is also a really big one, and scars and ports that, just creates a lot of body insecurity. Another survey that was put out looked at 3,000 women that had breast cancer. And again, it goes to speak to these issues related to intimacy. 85% really had a loss of intimacy. 60% detracted from enjoyment. 43% said it interfered with their relationship. 30% negatively affected their sleep. 27% adversely affected general enjoyment of life. These are, shouldn't surprise you. This is what's happening. And, I think that what we have to realize is the why. All of it sounds familiar to you, I'm sure. But, why is this happening to the majority of women? And when you think about the treatment of breast cancer, it really does focus on removing estrogen from the body. I mean, you want it completely out of your system in one way or the other, especially, depending on your receptor, positive or negative. We know there's a influence. It's all about either removing the ovaries, radiating the ovaries, getting chemotherapy, or, the endocrine treatments. It's all about suppressing estrogen's production. Well, no surprise here, puts women into menopause. Now, certainly the average age is 51, but if you're 30, 25, it's early menopause. And that's really the problem here. I have to talk a little bit about menopause because the focus will be on certainly, the sexual piece to it. But all of you who are cancer thrivers, these dwarfs: itchy, bitchy, sweaty, sleepy, bloated, forgetful, and psycho. They're real. They're real. And I'm just going to mention, some of the 35 symptoms really overlap, and we don't give enough attention because cancer thrivers, they're just worrying about getting healthy. The top 4, maybe no surprise to you: hot flashes, night sweats, irregular periods, and mood swings. And of course, there's a host of others. Someone had asked about body aches, and that's one of the symptoms of menopause. So I'm sure none of these surprise you, but as it relates to your interest in sexual intimacy, there's just such overlap, and we'll dive deep into vaginal dryness, but this is really what's happening. Someone did also ask, about treatment and lifestyle. So I'm just going to touch briefly on treatment strategies because someone said, well, how do I keep healthy, during menopause? So this is really addressing that question. And we love the Mediterranean diet. We just know it's so healthy. And just for long-term, for heart disease prevention, keeping your weight down, diabetes, and high blood pressure, it's very good. As it relates to menopause, of course, you want to avoid those spicy foods and caffeine, because that will increase symptoms related to the vasomotor, the hot flashes and night sweats, and alcohol is included. Dressing in layers, sleeping well, 6 to 8 hours, reducing alcohol. These are all really important, and certainly getting your exercise. Acupuncture helps well. Doing Kegel exercise to strengthen your pelvic floor to kind of reduce your risk of incontinence. Relaxation techniques are always important. And some herbs that have been scientifically tested work really well for menopausal symptoms. Passion flower extract was studied. There was a poster at NAMS, the Menopause Society, that it could be given to women with breast cancer. Of course, it's always important to discuss this with your oncologist. Treatment, it goes on for 10 years. So we're going to now really speak more to vaginal dryness, because this is what happens. Estrogen is gone. There's less blood flow to the vulva and vagina, less moisturizing, less natural lubrication. This is all what starts to happen. Sure, some of you can relate to this feeling, or maybe it's this feeling of what happens to 1 in 3 women who have painful intercourse. And again, no one's really talking about it. 45% of women never have had the conversation, with their healthcare provider. We all kind of know the term for vaginal dryness a little bit differently. I always have to put this in because I think it's kind of, this is how you feel. It feels like sandpaper. It feels like a back cave, chapped lips, catcher's mitt, cotton mouth. These are just some of the things that come to mind. But certainly medically speaking, you might have known it as atrophic vaginitis and vulval vaginal atrophy. Sort of the end result on the vulva and vagina and bladder is called genitourinary syndrome of menopause. I'm going to refer to it today as GSU, just it's easier to say. But this is really the problem, sort of from the issue of avoiding sexual activity. Genitourinary, that speaks to the vagina and the vulva and the bladder. And this whole syndrome really affects the physical changes that really do impact negatively the quality of life and, of course, the quality of your intimacy. We know just in general, 50% of the population suffer from GSM. And we also know that cancer thrivers even have more problems related to GSM. And again, it's the most underdiscussed and untreated of the GSM patients are cancer thrivers. So it's again, we talked about the treatment and how it really drives, sort of this premature ovarian issues where estrogen's gone, or if you're in menopause, it somehow heightens the symptoms. And again, clinicians are just not talking to their patients about it, because it's an awkward conversation for many to have, both from the patient standpoint and from the physician standpoint. The symptoms really do become disruptive: vaginal dryness, burning, irritation, painful sex, urinary symptoms of urgency, dysuria, which is painful urination, recurrent bladder infections. The clitoral tissue actually starts to shrink. The entrance to the vagina gets smaller. At the introitus, we call it introital stenosis. The tissue is very friable and thin. The color changes. There starts to be sort of these spider webs of blood vessels, ulcerations, tears. It's very uncomfortable. And of course, this is where tears with intercourse occur. I like to show this. I hope you're okay with me showing this, but I think, again, it really drives the point home. I always, I'm a very visual learner, but, if you look at sort of the first one on my left, this is classic. The tissue is very pale. Everything somewhat shrinks, the fattiness of the vulva. gets a lot thinner. The tissue just looks pale and thin, and the entrance starts to get smaller, especially if nothing is going into the vagina itself. The middle one is sort of a GSM vagina with yeast, more prone to yeast infections, and you can kind of see the irritation and rash along the labia majora, the larger lips of the vagina. And the far right, to my right, at the 9 o'clock position, you actually see a tear from having vaginal intercourse. Now, I will say this: the good news is the NAMS, which is a North American Menopause Society and International Society for Study of Women's Sexual Health, ISWISH, they have band together, and they are wanting to create sort of the safe treatment options in women who, either have breast cancer or high risk for getting a recurrence. Their goal is very clear. They want to improve the quality of life for this group of women. Data has not been great. It's not really out there. We don't have these double-blinded randomized studies looking at women using estrogen because it's such a no-no. So we don't really have it, but the goal is there. They're looking at, sort of what we can do about it. We talk about it, how we can improve sexual functioning. And this is exciting part of what's been happening. I think from my standpoint, and if in a perfect world for me, treatment for GSM, because we know it's going to happen. It should start to happen before treatment actually is initiated. I really believe that, your first visit, as you're, understanding the roadmap ahead, that it's at that time where your oncologist says, I'm now going to refer you back to your gynecologist to talk about strategies, because a lot of times the oncologists, they're just not so comfortable, talking about this problem. So the gynecologist is going to always be, in my opinion, the person that should be partnering very well with the oncologist, whether it's your support groups, whether it's at the treatment center. It should just go hand in hand. And one of the questions, and of course, this is what we're talking about, is, what can be done to take back your intimacy and improve your quality of life safely? And this is a fair question. I always like to say, look, we have to do a reset. You have to know what's ahead, and you have to do a somewhat of a reset and taking back and getting control of your intimacy. It's in part where your healthcare provider has to either address it ahead of you, or you address it knowing what's to come. But there has to sort of be some validation that the effect of GSM, what is it going to do to my intimacy? What's it going to do to my sex life, either with yourself or with a partner? And certainly if it's with a partner, it just adds another layer of a challenge, because it's so important once you sort of get through the treatment and you're feeling good and you realize breast cancer, you're going to do fine, you're going to live, and you're going to have a good quality of life. What can you do to bring back the intimacy with your partner? So it's so important that you do seek treatment for relieving these symptoms. And we know it has to be a team approach. Just, no two ways about it. Your oncologist should be arm in arm with your gynecologist, who's arm in arm, maybe even with your pelvic floor specialist, and your acupuncturist, your nutritionist. We all have to stand together, and work together and really communicate so that you feel heard and validated. We have to talk about, just the basic treatment considerations. And again, the oncologist and your receptor status, your genetic characteristics, extent of disease, time interval since diagnosis, then response to prior therapies, has to be involved, and it has to be communicated, and you have to feel confident that given all these treatment considerations, that you're going to be okay with some of the basic treatment strategies. We really look at over-the-counter vulvar and vaginal moisturizers. It seems so simple, right? I mean, estrogen, you turn it off, and it is a great hydrator. It's really like our superpower hormone, but it is such a moisturizer of inside the vagina. As I mentioned, when that turns off, the drying process begins. So using a moisturizer, it can be very basic. Now we're starting to see a lot more products, which is great. Moisturizers for the vulva. But guess what? You can just use coconut oil. That is my go-to product for a perfect and safe, it's antifungal moisturizer. Put a bottle in your shower. There's some that you can get on Amazon that are very inexpensive, that don't get hard when the temperature gets cold. Or even better is you can put a handful in your bathtub, the kind that gets hard. Sometimes I'll use Vita Coco. Just put it by my bathtub, take a handful in warm water and soak in it for 20, 30 minutes. If you did that 3 times a week, it moisturizes the vulva. Why does it matter? If you think about what I've said about GSM and how the clitoral tissue and the erectile tissue that's under the clitoris itself that you can't see, everything gets smaller and drier. So by hydrating the tissue, and when there's stimulation of the clitoris with touching or even with penetration, it reduces the discomfort. So that's on the outside. This, is just step 1. Step 2 is, how do you moisturize inside? Because again, the vagina inside tissue, it really needs to maintain that integrity and elasticity and pliability. So there's many different, very safe, these are all very safe ways to moisturize. Hyaluronic acid is one. I find it a little watery, that's used as a suppository. It doesn't have the staying power. Ki is my personal favorite because it's coconut oil, palm oil, and vitamin E, and it's an little almond shaped. Put it in your refrigerator. You again get it on Amazon, and you just insert it into the vagina before you go to bed. And it doesn't run out as much. So it's a great way to hydrate inside. And, for me, I do it every night. And then there's some other ones, Replens Me Again, Pro Hydrate. They're all very safe to use and very vagina friendly. In general, you can use them every night or every 3 nights. It's really safe. I've always tell my patients, regardless of any medical history or certainly cancer diagnosis, that we should really be treating our vulva and vagina like our face. We hydrate, we use a special moisturizer, we use a special cleanser. And if we were doing this, starting at a young age, a lot of these problems wouldn't really be happening. I mean, certainly menopause, perimenopause, cancer diagnosis just adds a whole nother element of discomfort. But we need to really start to take care of this area with much more dedication. And it's never too late. So this is sort of my go-to step number 1. Lubrication. Well, of course, everybody loves lubrication. They did a study with almost 2,500 women who used a water-based or silicone-based during sexual activity, and 70%, liked using a lubricant. No big surprise. And certainly, in this conversation, it really does reduce friction, tearing, and discomfort during any sort of penetration, whether it's, with the penis, fingers, dildo, whatever your interest is, but it is very, very helpful. So bringing in a lubrication just at the time of any sexual activity, should just also be part of what you're doing to improve intimacy. What about hormones? This has always been an issue for the safety. There's been limited data, we know, limited information. And oncologists and women are frankly just terrified to even think about using hormone therapy. I'm really referring more here to vaginal estrogen, because I think that is, as you may or may not know, that is the treatment for GSM. Now, there was a recent study, and this is sort of the good news that I want to share with you, is that there was a study done in an article in just August of 2022 that was published in the Journal of National Cancer Institute. And what they found, they did this observational study, and they found that it was safe to use vaginal estrogen. It didn't increase your risk of any recurrence or mortality in those that had breast cancer. So that was very exciting when it came out. A lot of us were thrilled. And certainly now we have a little bit more progress in reassuring you that you can use vaginal estrogen. Again, this is the sort of recommendation is a quarter vaginal applicator every 3 nights. And this also included DHEA or testosterone that you can also use every 2 to 3 nights before bedtime. I mean, this is really food for the vaginal tissue. It's very helpful at relieving symptoms. But again, you sort of know now you can, use your moisturizer if you're not comfortable, but it's definitely available. And discussing with the oncologist is certainly important in giving approval. Now, we have to make sex something that you want to have. You and your partner, if you have one, you're in this together. You've been in this together, and the journey of breast cancer, it's not a sprint. It's more like a triathlon, right? We know that, and I think it's helpful when the partner goes with you to your oncologist, of course, goes with you to your gynecologist. I love when partners join me. I think it's so helpful. And, it might be, your therapy session, or maybe you're going to go to support groups. But I think that it's very helpful so that you don't have to do the spin in the wheel. What about other, helpful options? Some of these we really don't discuss enough. But in addition to the moisturizing, in addition to a lubricant, you can use topical lidocaine, sort of at the entrance to the vagina, usually between like the 4 and 8 o'clock position. It can be very helpful and soothing. Mona Lisa laser, it's a fractional laser that does bring more blood flow and collagen production to the vaginal tissue. I like to do the Mona Lisa sooner than later, before the tissue of the vagina and vulva gets so thin that it's sometimes harder to bring back. So, the biggest downside with the Mona Lisa is that it's a little costly. It's not covered by insurance. I wish, and I hope someday, that in these oncology offices, with all that they have, that they would have a room and an area for the Mona Lisa laser and for the sexual conversation to take place. Vaginal dilators are also very important. I'm going to spend a little more time talking about them, but they do reduce pain with penetration by improving the tissue elasticity. Vibrators, again, very helpful, in part because, as I mentioned, less blood flow to the vulva, less blood flow to the clitoral area and the erectile tissue. So bringing in a vibrator, which vibration used to be used for the treatment of all sorts of sexual dysfunction. That's how it originated, but it's very helpful at bringing more blood flow, improving desire and arousal and orgasm. So it's quite nice. And if you don't have one, please go out and get one, because you will be very, very happy, and so will your partner. Pelvic floor PT also is very helpful, reducing pain with penetration. I really wanted to spend a little bit of time talking about vaginal dilators, because this is one of the least talked about treatment options that is so helpful, because if you think about it, it's not just about the lubrication. And that's what a lot of people think. Oh, just use some lube. You won't have any pain with sex. But the truth is the entrance, the introitus, is an area where there's a lot of discomfort. Someone had asked me, one of the questions, the Q&A was, how will I ever have sex again? Will it not hurt again? And what happens is the entrance to the vagina, it gets small. And if you remember that photograph, if you are, really not having penetration with anything, any object or penis or fingers, the entrance starts to collapse. I wrote a whole chapter about it in my second book called The Collapse V, because again, it's not just about a lubricant. This is more of a mechanical way to retrain and increase the elasticity of the vagina. It prevents narrowing. You can see all the benefits here. Restores the capacity of the vagina. It stretches the opening. And it really makes penetration so much nicer and so less uncomfortable. So I really highly recommend it. These are sort of the two that we know about. The Soul Source was one of the original dilators that came out. I worked with someone to make them wearable and just as an option for women, but it's very important to think about ways to help stretch the opening of the vagina itself. And dilators are a great way to do that. The other thing is, here's the thing. Now you're comfortable, you're getting your moisturized back, you're using something on the outside, the tissue feels better, you're more in the mood. And I think it's really important to get creative. Getting creative, it's, you're never too young and you're never too old to get creative in the bedroom. And, breast cancer, it stops us in our tracks so much. But I do think that by, really doing all of this homework and, maybe bringing in the vibrator, it really is helpful. And I think, dedicating yourself to your lady parts, once you sort of are able to get a handle of the breast cancer, it's going to be worth it for you and your partner. Partner, yes, it's they have to be involved, regardless. There's just so much going on. And I just want to remind you that sexual problems involve both of you. And it's just important to be able to, talk to your partner about what's happening. And I'm sure that they will really appreciate that. If there's one thing that I could leave you all with today is to be your best healthcare advocate. Cancer thrivers, they definitely have a right to their sexual health. And if I could leave, you with one action item, it's just continue to be your best healthcare advocate. Ask questions, learn from different educators, find reliable websites, and just know that your sexual well-being and your quality of life will depend on it. Sometimes taking the approach of talking to your doctor about what's been happening. Thank you so much for having me today. This is a topic that I really enjoy discussing, and I hope you've learned something today. And certainly, if you have any questions for me, these are some of them that were asked earlier, and we can sort of touch on them again. If I didn't answer them, these is about the books that I wrote. And if you want to continue following me, or if you have any other questions for me, please feel free to do so.
Dr. Shery, thank you so much for your presentation. What great insight and information that you provided to all of us on a topic that that is challenging to engage in. So we really we thank you so much. We have received a couple of questions, so I will begin with some of those. And the first questions that has come in Does having sex elevate the estrogen level in the body? So that's one question one of our participants has asked.
Yeah. Yeah, that's a really good question. Fortunately, it does not. But one thing we know is the more sex you have, um, the better it is for the tissue. There's more lubrication, natural lubrication when you get excited. There's still production of sort of the wetness that comes out naturally, and with orgasm as well. So, there's truth to sort of, if you don't use it, you'll lose it. But fortunately, there's no increase of estrogen production.
Great, thank you. And I invite anyone to type a question into that Q&A feature that you find at the bottom of the Zoom window. So if you have a question for Dr. Shery that wasn't answered in the presentation, please feel free to type it in there. We may not get to every question, but we'll get to as many as we can. Another question has to do with the use of coconut oil in the bath in the way that you described. Can you use it if you use condoms? This individual says, I know you're not supposed to use it as a lube with condoms, but is it okay
Right.
to use in the bath in the way that you described in your presentation?
Yes, and that's a really good point. That if you're, some people use coconut oil as a lubricant, but you can't use oils with condoms because they do, affect the integrity of the condom. But in a bathtub, go right ahead. It is, really helpful, and it feels so much more moisturized. You will become a big fan.
Great, thank you. Another question that we've received is what can be taken to improve the sex drive? Is there anything that can be taken that would help with that?
So the sort of our version of the blue pill is the pink pill, and it's called Addy. And it works more centrally in the brain. And what it does is it sort of helps with more desire episodes. It also works to increase blood flow vaginally as well. But I don't think that there's any reason that women could not take it. Part of the issue is it increases your desire, right? So if I said to you, well, it's going to increase your desire maybe 2 times a month more than usual. That's what we're seeing with Addy. So the results aren't, they're not bad. At least it's something, but they're not huge. So I think it's again, discussing it with your oncologist, whether you want to, try it out or not. Sometimes I find that when you feel better about yourself, you feel much better about your, vagina and vulva because you're moisturized, you may be using your dilators, sex isn't going to hurt. Your desire improves, because desire for women is so complicated, and it's really the number one, our sexual dysfunction has to do with desire. So doing things to make knowing sex is not going to be uncomfortable is going to do so much for your desire as well.
And a clarifying question on that on the medication that you just described is, could you spell it out?
It's ADDYI.
Great, thank you. And then another comment about ADDY. Is it or is it not appropriate for women who have gone through menopause?
So another really good question, because the studies that were done on Addy were done on premenopausal women. So that was really the indicated group. I know they're doing ongoing studies for it now, and I don't think the studies are yet known. So it's sort of the success in menopausal women isn't as well documented, but for some women, they want to try just about anything. And so this is why we see women wanting to try adding, but no conclusive studies yet for menopausal women.
Great, thank you. And then a question, does having sex while on chemotherapy pose a risk to your partner? And second part to this, and if yes, how do we protect our partners?
I am not aware of any risk to your partner if you're undergoing chemo. Um, it tends to, chemo effect really does work very well, as you all know, on your body. And it shouldn't, through exchange of saliva, whether it's vaginally through oral sex or kissing. I'm not aware of there being any risk to your partner, but certainly the oncologist would be the one that I would, want to double check with.
Right. And then another question about reaching an orgasm and struggling with that, and and a question of help. What
Yeah,
what's your advice, your recommendation for that?
yeah. This is a big struggle that women are having. And I think the first step is really understanding the why. Is it, we know emotionally it's very hard to, you're going through your own struggle with the process of treatment itself. So a lot of women struggle from depression and anxiety. And, having an orgasm is so mental, right? Our biggest erogenous zone is our head. This is where desire really starts. So if none of those are the case, and you've had orgasms before, so you're capable of having it, vibrators are really helpful. There's some out there that are just very gentle, very easy, and I think it's really understanding the why it's been hard, and sometimes seeing a therapist helps differentiate that. But if it's just that you need a little help, I'm a big fan of using a vibrator, being in a room with no distractions, having maybe your favorite music in the background, and maybe not even with your partner. I think sometimes it's better and easier when it's just you. But if all the usual tricks fail, I think talking to a therapist, and a sex therapist might even be helpful.
And then someone else is asking about a question relating to the use it or lose it tissue health that you talked about, and what if a partner's sex drive doesn't match your own? You know, recommendations for in that particular instance.
Yeah, I see that all the time. It's a struggle, and I think especially as we age, and maybe as your relationship has gone on, we do see this imbalance. This is where communication really comes into play, and if you still like each other a lot, and maybe there's a medical reason, certainly your struggles, but if your partner has a medical reason too, you know it's there's a lot of balls in the air, and that's where sometimes seeing a therapist helps understand sort of the struggles. But I think masturbation is really important and great. And if you still really, love your partner, but they're having their own issues and you still want to use it so you don't lose it, or at least, it's almost therapeutic in a way to have an orgasm. It's good for sleep. It's good for, moisturizing the tissue. It's good for your heart rate. It's anti-stress. It's like there's so many health benefits of having orgasms. So I think sometimes you just need to use your own prescription of taking care of yourself sometimes too.
And then an additional question related to the vaginal tissue health, and you spoke about it, the thinning, and several other things. And um, you know, uh, can the tissue be brought back? Is the question.
Yeah. It definitely can. I mean, definitely can. I think you have to really be patient, and do your homework, because it kind of is homework. You have to remember, to use something like, for example, if you were going to say, well, how can I start to moisturize the, outside and inside? So outside, it could just be coconut oil baths, and or you get some in the shower where can pump it. It's filtered, so it doesn't get hard, and you just apply it to your, the outside, the vulvar area. Inside, you can get some Key E, at Amazon. They're very inexpensive, and you use it nightly. And after 2 or 3 weeks, you're going to notice a difference. And I think if it's, the penetration piece, that's also takes a little bit of time. If it's been, months, or some women and couples, it's been years since they've had vaginal penetration. And dilators are just so helpful. But again, it takes time to really get that tissue back into shape. It may take 3 to 4 months to be able to have penetration sex again, assuming you're using your dilators and using the moisturizer. And if you use dilators, you really have to use moisturizers first, because the dilator can stick to inside of the sidewall. So working with someone that can help, champion you and help you with success is really important too.
Thank you. You've talked at great length today about oncology providers and incorporating them into these conversations. And what recommendations do you have when an oncology provider doesn't want to uh, address or talk about sex and intimacy issues? In your practice, what advice can you give to us for to how to
Mhm.
address that?
Yeah. And sadly, this is more the norm. So you're not alone. I mean, honestly, your gynecologist should pick up the slack, I feel. Um, Even if, you go to the gynecologist to talk about GSM, I think it's important to have them maybe, can you ask my oncologist if this is safe, if they want to use vaginal estrogen? Because sometimes the gynecologist can step in and help. But I honestly would say I think the oncologist is not well versed or comfortable talking about sex and intimacy as much as the gynecologist is. So my best advice is use your gynecologist. If you don't have one, you need to find one that can help you, because there are solutions. And granted, we have a very broken medical system. The average time a doctor spends with the patient is 7 to 11 minutes. It's really hard to jump in and talk about sex, but there are doctors out there that will take the time with you. Or organizations like the one you're part of right now, I hope that they have more of a built out program that can help give you the information you need as well. I hope that answered your question.
That was wonderful. Well, we are nearing the end of our time together. And Dr. Shery, I want to thank you so much for your presentation and for sharing so much of your expertise, your thoughts, your heart, your passion with all of us. And I want to thank our attendees today for your participation, your engagement, for the thoughtful questions we received from all of you at registration and here today. If you want to learn more about the cancer support community, Los Angeles, you can visit our website at cancersupportla.org. That was in the chat from earlier. And then if you have any questions for us that you'd like us to pass along to Dr. Shery, you saw her contact information, but we're happy to answer any of your questions as well. Pass anything on to Dr. Shery. You can email us. And that email, I see it now coming up in the chat, is info@cancersupportla.org. again, info@cancersupportla.org, and reach out to us for questions about this webinar or any other needs that you may have. I also want to let you know when the webinar concludes, through the email you registered with, you will see a link to a quick survey. It's 5 questions. If you wouldn't mind taking that survey, it'll just take a couple of minutes of your time, and it'll help us, understand what you learned from today, what you got out of the webinar, and we even ask a question about future webinars and what you'd like to hear. So if you'd take a few minutes to complete that survey, that would be wonderful. Thank you again, everyone, for attending. And we hope to see you soon at another educational event. Take care. Have a
Thank you
great
for having me.
weekend. Thank you.